standardization, reductions, rules and requirements. Against, we have some companies present today which work in pairs in various bundles, and we hope that they will prompt us also as to what we may improve further. These are the issue of the long-term planning, and again, contracting is also a part of it. And here I will look forward to hear certain comments from Mr. Varahov, not as a co-moderator, but rather the member of the Parliament, the representative of the people who currently is doing a lot of work related to procurement and contracting and execution, because we're living through a definitely digital era. And so these tools, and the question is, how are they to assist us, and how are we to control in terms of what is being done, because this is what is being put into the umbrella that covers it. How efficient is the system, how effective it is in achieving the results. So the system of supervision and control is important. And as I promised, the overarching one, and another important point, which is the professional training of experts who, in a very literate and professional way, should deliver the importance of the inoculation to the population. So, basically speaking, here I'm gradually coming to where we shall launch our discussion, which is about the execution, because every system, here we've got strategy, we've got experts here who I'm going to ask to comment and tell us a few more details about the strategy. What does it have inside it? What are the basic elements of aspects that are made up of it, and its foundation for basically the foreseeable future, which is 2035. So the second thing that I should say we are going to discuss, this is the roadmap, because the strategy is a certain destination, general one, where the key point is how to and what to fill it with, because how it's going to be acted upon. This is the plan of activities, the timeframes for them, those who will be enacting them, and the expected deliverables, and how we're going to control them, and the interagency interoperability, which is something that we should talk about, which is effectively the kind of a formula which we arrived at exactly 1 year ago during the previous discussion, when we agreed that only then the system would work effectively when we will have an effective interagency operability. And here again, let me quote Veronika Skvartsova, the Minister of Healthcare, who during the autumn, during the forum taking care of people's health, she said that the inoculation issues, these are not just exclusively the kind of issues that the Minister of Healthcare should be held accountable for. This is a much broader kind of a thing, and that is why the system of effective cooperation inside the government, between the government and the businesses, would be a key success factor. And so, in as far as this is concerned, it would definitely be desirable for us to try and gather certain ideas. But let's move over to the final point of my introductory word. So here are the basic challenges that we are putting into the agenda of our debate. And so I suggest that our current experts in their presentations should comment upon them, not in terms of just comments as such, but just the ideas and proposals. What is it that we're able to propose? What can be put into the foundation of the roadmap? What are the elements that we should take into account in it, so that the 2035 strategy is successful, so that it is executable? And here, like I mentioned previously, the basic elements are in front of us. We have highlighted them. So if there are any other to be put on it, we will definitely be happy to do so. And I wish to all of us a very constructive debate, and based on what we discuss here, we will put together a list of ideas, and we will forward it to the Ministry so that the roadmap of that strategy could be both productive and effective. Dear colleagues, let me pass the microphone and introduce our first speaker, first expert, Sergei Krayevoy, Deputy Minister of Healthcare of the Russian Federation. Well, Sergei Alexandrovich, it is already a tradition, I'm very happy to state it, that we start this year and we hold this kind of a discussion between us. And we would be very happy to hear from you. What are the main emphasis? What are the main points of the strategy until 2035? What are the main challenges, the way you see them? And traditionally, what is your vision about how together we're going to overcome them? Thank you. Good afternoon. Dear colleagues, it is true that this session has become a traditional one, and this is really very good. Why? Because effectively the vaccination is currently the most effective method to improve the general level of health of the nation, and consequently the extension of the life expectancy. Why? Because, as paradoxical as it may sound, we have since long ago come out of the times when people would die directly from the infections, and we are in the timing when people die from the kind of complications, somatic complications, which develop in the process of infectious disease. And today's session is taking place, I should say, in a very momentous way, because today there was an address made by the President to the Federal Assembly, and he started his speech by citing demographic problems. And the demographic problems is made up of two parts: improving the birth rate and extending life expectancy. And so this session of ours is dedicated to the life expectancy extension. And I would like to cite several examples to you so as to demonstrate what I've previously mentioned. For example, since 2006 we have run quite a big campaign to expand the national inoculation calendar. What it has led to is that the hepatitis B as a disease has gone down almost 13 times, thanks to the fact that one of the first inoculations being administered to a newborn is HB. Now, the rubella has gone down 10,000 times, apart from the fact of what we have in our inoculation calendar. We have this inoculation against rubella, and I would like to remind you that our national inoculation calendar, these are the inoculations which are being done at the expense of the federal budget and being procured in a centralized way and being made available to the hospitals and medical institutions, include inoculation against 12 infectious diseases. So practically this country's calendar complies with the most possible broadest developed economies in the world. Apart from that, we also have epidemiological calendar. These are the kind of the vaccines which are being procured through the regional budgets or by the employers, and that calendar additionally includes 16 infections. And so all together, at this point in time, we have on a compulsory basis vaccination being done against 28 infections. But Alexander started this meeting with a certain issue which penetrated through all of the slides, like the awareness and the adherence to immunological prevention. This is a very important thing. And we may be witnessing a situation when the decrease of an infectious disease rate against the backdrop of the population immunology as the result of certain inoculation effort leads to a certain complacency when people think that they don't have to make any more inoculations since the disease is not going to come back. Last year, I participated in the vaccination conference under the auspices of the European Union. A very big event it was, attended by the WHO General Director, at which they debated the issue of a very dramatic increase, and very specific case was the measles, against the massive immigration into Europe, and simultaneously the activation of the so-called anti-vaccination lobby, when people effectively stop getting inoculated. And I will mention about it a few minutes later. So one of the results, expected results of the deliverables of this round table should be a certain appeal that we should work out towards our citizens about the importance to adhere to the vaccination and inoculation. But generally speaking, as far as further improvement of it is concerned, Alexander was quite right in saying that in July there was a presidential assignment issued to develop the strategy for vaccination and immunological prevention until 2035. More than 10 federal executive agencies participated in this meeting. The strategy was put together, and in the end of December, if my memory serves me right, it was on December 27th, it was submitted to the Russian cabinet. in the form of the draft government decree, and currently it is being cleared through the government. And it is necessary to note that, first and foremost, the purpose of the strategy is certainly a prevention and to limit the spreading of the infectious diseases by the controllable methods of a specific vaccination and inoculation. So the strategy deals with a few issues. First of all, as I mentioned, raising the awareness and developing the adherence to the inoculation. Second very important task is to develop new vaccines, and while developing new vaccines, we act on an understanding of several indicators. The first one is a danger of an infectious disease from the point of view of a quick epidemiological spreading and a possible mass development of such a disease conditions, and secondly, the development of a disease whereby the means which we subsequently expense upon treatment and rehabilitation turn out to be much more significantly than the price paid for the vaccines themselves. This is the foundation of a choice to be made of how to develop into the future and the way we procure new vaccines, either the mass nature of the disease or the importance of this or that disease. Next one is the development of efficacious vaccines. We must be rest assured that the product that we're developing that passes through the clinical trials and then is released into circulation should be good quality, efficacious and safe, and the expected benefit should considerably exceed a possible risk from the application of a product. The next extremely important area is the need and effectively that passes as the permitting topic, either the need to have a local domestic manufacturing or the ability to localize the production of an immune biological product from overseas. To our great regret, we have not a very good experience when we already lived through the period when the country effectively ended up suffering from a polio vaccine. Here we have Vladimir Kristenko representing the Minister of Healthcare, and the Minister of Healthcare expressed his gratitude specifically to the company he represents, which effectively, in an extremely expedient way, helped this country and managed to make the necessary amount of polio vaccines available, although since 1997 Russia has been considered to be free of the poliomyelitis, which was brought about by this wild stem of this virus. So these risks, which may emerge because of the lack of our own domestic production or localized manufacturing, are impermissible, because if the vaccine is being entered into the national inoculation calendar, it becomes the liability of the government with respect to an individual citizen, and so the citizen is entitled to get it. We continuously work over the continuous improvement of our calendar. Currently, we are expanding, on the one hand, the lists that are entitled to have such a vaccination. A good example is of us currently running a vaccination campaign amongst the seniors of our country against pneumococcus. That is the fact that we are also broadening the lists of children who are entitled to have vaccination against hemophilia. And, of course, together with the businesses, and I'm sure that Sergei Anatolyevich will talk about it, and other company representatives will follow suit, that considering the further development of vaccines and the ability to release these vaccines into the Russian market or their localization, we plan to expand our national vaccination calendar, and as the manufacturing processes are being set into place, hopefully that'll be by 2022, we will have the foot and mouth disease prevented. 2023 will be the smallpox vaccine. 2024, the human papillomavirus. And apart from it, this year, and I would like to inform you, which is very important, for the first time ever, we have procured and released into the market and had inoculated about, if my memory serves me right, I think about 5,000 doses of quadrivalent vaccine from flu. So we have been having vaccine which contains 2 types of A virus and 1 type of B flu virus. And so, as a rule, sorry for such a lingo, the tail of the flu disease which emerges towards the end of March is because the 3-valent vaccine doesn't have the 4th component, which is the B flu. And not always. I mean, it is quite inclined to mutate. So not always the specific protection remains active. So this year, for the first time, for the risk groups, which in the first place included the healthcare professionals, the representatives of the educational sphere, where we were able to also spend additional money and buy this groups of risk were able to inoculate. And so together with the Russian Consumer Oversight, we have developed a joint plan to gradually switch to the 4-valent vaccine. And until 2022-24, we're planning to switch over to the 4-component vaccine. The only thing that we are going to ask our good manufacturers to expedite the registration of the 4-component vaccines for children. This is just now the 4 million, 5 million doses. Yes, this is, let me take a look at the table here. The quadri, to be more exact, 5,423,552 doses worth 2 billion rubles. But the national calendar for our budget constitutes quite a significant amount of money. The national calendar last year had 23 billion rubles dedicated to it, allocated, so as for your understanding. Thank you very much. Good afternoon, dear colleagues. Being a co-moderator, first of all, I would like to compliment you, Alexander, because this year passed very quickly, and it was exactly this room where we have gathered last year, and to a certain extent, we've been quite emotional, I remember. But then quite a few felt that that was a very serious problem, and it only is becoming more and more serious. And so your introductory word and the presentation that you prepared do bear the nature not of a discussionary thing, but of a very serious sorting out of what we are to do, where we are to go. So the fact that during the St. Petersburg Forum this issue was debated quite actively does reflect the real importance that it has. Sergei Alexandrovich mentioned that vaccination is a very effective tool, and it does conform to the financial legislation so as to spend little but be able to gain as much as possible. And so with this in mind, I wanted to raise 2 questions, maybe even 3 to be more exact. When this strategy is going to come out preliminarily, and secondly, you mentioned that as the organization of manufacturing capacities is going to be organized and improve, the national inoculation calendar, and we will definitely be looking forward only towards the point in time when the manufacturing is going to be raised to the proper level, or will there be any other vaccines or any other means to prevent diseases going to be used that our people require? And the third question, which is something we see raised quite often when putting amendments into the Federal Law number 44, which is the procurement plan, and essentially the lack of a certain standardized approach to procurement planning quite often leads to some serious problems. But overall, since you mentioned the presidential speech earlier today, that's what he was talking about. Yes, I would like to hear certain answers, but at the same time I'd like to come up with a proposition, because quite soon we expect the government to come up with a very powerful, very extensions, hardly will be like that, but a certain package of changes into the Federal Law number 44. It contains quite a body of amendments that we prepared in a joint effort with the manufacturers. At least we've debated them, really, very seriously. But in any case, if you feel there is a need to adjust something further in as far as the immunological prevention and inoculation is concerned, we do have such an opportunity. At the same time, understanding that the government is supposed to do a lot of work on its own, just bear this in mind. So that's what I would like to hear about in terms of the questions. Now, with respect to the first question, when the strategy is going to be out, as I previously reported, let me give you an exact answer. December 27th, 2019, the letter, I'm not going to read out its number, the strategy has been submitted to the Russian cabinet. So at this point in time, the text of this draft and the decree, and respectively the strategy, is in the hands of the government. And I believe that is just the first working week. Yes, so very shortly, yes, I think very shortly, and this is something simply because that is the presidential assignment, not only the Ministry of Healthcare and other federal agencies are interested in this, but also the government staff and the cabinet itself. So very shortly, I'm confident. In any case, I believe that it will be actively further improved through the government staff, and I would like, and I hope that in Q1 it is to be signed. Now, and as far as expanding the national inoculation calendar is concerned, through other approaches. I've stated already that we, some 2 years ago, we had a very surprising situation, and we had money and we couldn't buy the vaccines. And every now and then it comes up. We're quite surprised, worried by it when we don't have our own good quality manufacturing. So we're actively working together with the Ministry of Trade and Industry. This, our compatriots, our followers. And so the approach is that these should be our domestic vaccines in the first place. Because on the one hand, this strengthens the sovereignty, the independence of the country, but it also has other aspects like biological safety and security. Tomorrow at the Healthcare Committee at the Russian Parliament, I'm going to report on the draft law about the biological security, which is to be heard on the 26th of January. It took us a long time to prepare this draft. We worked on it since 2013, and towards the end of last year, it was submitted. So you have several aspects to it. Therefore, our position is such that the national calendar must be, sorry for such a word, closed, or rather covered by the vaccines through the domestic manufactured vaccines or the ones which have been localized in this country. Earlier, I mentioned Vladimir Kristenko, and I would like to also mention that last year, Vladimir, was it in autumn that the agreement with the Chumakov Institute was signed? This is our R&D, Russian R&D center under the Russian Academy of Sciences, which have established a domestic inactive vaccine and signed an agreement to launch the manufacturing vaccine against polio. And the third point was about procurement. In the presidential assignment dated July last year that we have mentioned several times today, The task, amongst others, is to consider the possibility of entering into long-term contracts, because in as far as the basic number of vaccines within the national calendar, we have defined a single supplier, which is the National Immune Biological Company, and so currently we are switching now to 2 to 3 year long contracts, which would enable us, in a very scheduled way, to supply a definite amount of vaccines according to the schedule, depending upon the needs. Particularly eloquently, one may demonstrate it through the flu vaccines, because we are delivering them into the regions in the first place, which are the entry, the gates into the Far East, the Northwest, where immigration traffic is quite active and where there is an active exchange of anti-genetic material between the citizens from different countries. Thank you. Thank you very much. Well, I'm sure that there are a whole mass of insights and interesting things that the experts will comment upon. I'm sure. Let us now follow our plan and hear the next speaker, Sergei Tsib, First Deputy Minister for Industry and Trade. Sergei Anatolyevich. And again, I'm using traditional words, but the Ministry of Industry and Trade, I suppose, is our key partner, the of the Ministry of Health, in as far as the inoculation calendar and the prevention of diseases is concerned. And so there are a mass of programs that you are in charge of, and of course, my question in the first place, is linked to the localization and technology transfer. It's a very complicated area, and I'm sure that its complexity comes from the need to first and foremost identify the borders of this localization, the framework of it. But on the other hand, last time, and in this discussion, we used to mention that this is a stunningly deep kind of an industry, which is the crossroads of many different technologies and sciences, getting such enormous potential. So what do you see as the potential for development of the contemporary immune biological vaccines in Russia, and what do you think about how one should properly calibrate this localization? What should be considered a local product in this sense, which further on, in accordance with the Minister of Healthcare, could be included into the calendar? Thank you. Thank you very much. Good afternoon, dear colleagues. First, that I would like to tell Alexander is that I cannot share with you the company's insight. I believe that if the companies would want to mention themselves, they would definitely make it public. But let me just mention a few data. And I will start with what we've been able to do during the past 5 years. I principally asked to be given a few statistics. If we take a look at the vaccines and the anti-toxic methods which have been produced in the territory of Russia in the finished forms and have come out in 2014 and compare it to 2019, then in 2014, the share of the Russian-made was 29% in value and 39.5% in volume. So, based on the results of 2019, it is more than 75% in value and more than 88% in volume. That's based on the 9 months results of 2019. So multiple increase, and these figures seem to me to be saying that a lot has been done, both at the legislative level, both at the tactical level, in as far as the support for the local domestic manufacturing was concerned, as well as the development of the localization and the immune biological drug manufacturing in Russia, and the cooperation between the Russian and international players. And, of course, the legal framework has evolved very strongly over this period of time towards incentivizing setting up the immune biological products manufacturing in the territory of Russia. Mikhail Albertovich, I'm sure later on, will be talking about the way control is changing in this area, which also, I feel, led to very positive outcome and would generate better results in the future to ensure the quality, efficacy, and safety of these products. On our side, we also did whatever we could in order to make these products affordable for the Russian citizens, because our basic mission, amongst all of us, is for such products to be comparable in terms of the quality and the price. And so certain things we've been able to do. And so it's really great to see that the epidemiological vaccination calendar and vaccination calendar as such is being fully covered out of the capacities of the Russian producers. You were quite right in saying that currently we need to think what's next, particularly in terms of the risks that Sergei Alexandrovich spoke about in terms of the national drug security. I can inform you basically that as tasked by the government together with the Ministry of Healthcare, we are putting together the new list of strategically meaningful and significant pharmaceutical products. You may recall in 2010 the government adopted such a list, and this list is based upon the principle of creating the full cycle manufacturing, including the synthesis of active ingredients in the territory of Russia. And so this is the kind of list that, together with our colleagues from the healthcare government agency, are putting together, which effectively is going to be linked to the national drug security, where the important condition will be to create a full cycle manufacturing for such a product in the territory of Russia, including the molecular fusion. If you may recall, we're working along the EDL list, which included quite a broad number of drugs and continues to include, and we only did some limitations upon the finished product in terms of what is to be considered the Russian-made. And so as part of the efforts dedicated to this particular list is that it includes the full cycle principle, including the molecular synthesis. So in as far as this is concerned, what are the kind of tasks we're facing for 2020 in terms of supporting the establishment of the full cycle manufacturing, including in the immune biological segment? Another thing that I would like to mention is that we have put together new tool sets for the support of both domestic and local manufacturers. We came out with various changes in our legislation in the industrial policy legislation, SPIC 2.0. That's what we call it, the special investment contracts. And so the companies, including the international players who are the signatories of the special investment contracts, or used to be in 2019, and also following the old legislation, can consider this current new one as a support for the establishment of such manufacturing capacity in the territory of Russia. As part of the government-sponsored program for the development of the pharma-med industry, we put together two new tool sets of the financial nature. The first one is subsidies. For 2020, we've allocated in our budget about 4 billion rubles. Today, the government is putting together a list of technologies, including in the area of producing pharmaceutical products, based on which various investment projects will be receiving financial support on a subsidiary of a subsidiary nature. And of course, this is the list where we would put all the technologies which we're currently lacking in the territory of Russia, and this list is specifically being based on that principle that it should include the list of technologies that Russia currently doesn't have. And therefore, in as far as this is concerned, that will constitute an additional support instruments for the execution of similar kind of projects in the area of creating vaccines manufacturing sites. And the second thing, and I would like to personally offer my thanks to Mr. Zakirov and from all of the colleagues from the Parliament who, in the end of the 2019, supported us. We, as the trailblazers, as always is the case, decided to produce new instruments to support research in the area of creating new pharmaceutical products, principally speaking, in the country, and try to establish a venture fund together with a Russian venture company. And so the government has endorsed our respective legislation, and as of this year we will start financing, amongst other things, the venture products along the lines of a jointly between the Ministry of Trade and the Russian venture company jointly created venture foundation. So I believe that the new projects of producing new immune biological products, new vaccines, is the kind of a topic which definitely could be implemented as part of this new set of financial instruments. And I would like to also comment, it seems to me, upon a very important set of things that Sergei Alexandrovich mentioned from the point of view of time frame of how these various new vaccines are going to be included into the inoculation calendar. Today, and as far as I understand, maybe it would be really worthwhile seeking your counsel about it as one of our proposals, since we understand what kind of a time frame there could be for the new vaccines to be included into the inoculation calendar. Maybe it would be worthwhile considering preparing amendments into the Russian legislation, specifically the immunological prevention law, which will specifically set these time frames. Why do we need it? Let me explain. This is necessary in order for us, as well as the marketplace in the first place, the manufacturers who are already working on the projects to achieve the production of such vaccines like the foot and mouth, as well as the smallpox and the human papillomavirus and hemophilia. So maybe it would be good for us to be able to consider this altogether, and Mr. Farahov may also be helpful, so as to consider this at this point in time, so as to not to delay trying to formulate the kind of changes which already will set certain milestones for the companies domestically as well as for the international businesses which are actively looking for partnership arrangements with the domestic manufacturers. And so I believe that this really could have been quite useful. I don't know whether there used to be such an approach in the past. We simply could think about this approach to start taking place. So this is what I wanted to draw attention to. And in as far as the companies are concerned, once again, I definitely don't want to really announce certain data that I have in my possession, because principally speaking, the representatives of all the companies are here in attendance. I can only say one thing: both the public and private companies, they all find themselves within the mode of implementation of either their own projects or the partnership project with the leading international companies in the area of producing immune biological products. And so whatever has been listed above today is what you may find in the portfolios of these different companies with different timeframes, with different plans, because this is not a fast-track thing. And so there is also a system of registration in this country. There is also a system which confirms the quality assurance. And today we have new legislation in place in as far as quality assurance principle is concerned with respect to the immunological and biological products that Mikhail Albertovich later on is going to talk about. So all of this has to be borne in mind. So I do say that in the end of the day, we as the Minister of Industry and Trade are targeted so that in the area of the immunological and biological products, in the area of developing vaccines and producing vaccines, to a much larger extent to incentivize and to strengthen the creation of such products in the territory of Russia, both in partnership as well as by individual Russian manufacturers who are currently trying to be very active. And further on in the future, we would be targeting to implement the plan of action that will be endorsed consequently after the strategy is out and is endorsed for the development of the inoculation and prevention in this country until 2035. That's basically what I wanted to say. Thank you. So again, thank you very much for such a commendation. But actually, it seems to me, like Alexander previously stated, yet again, he really described you as the real partner. You truly demonstrated to be a real partner and made the funding available through creating this venture fund, because that doesn't only mean that the healthcare problems are going to be worked on and resolved, but this is quite a serious step forward that never before had ever been undertaken. And I'm really happy to see that it took place. And making a reference to the presidential address, who very clearly stated that the initiative must not be punishable, and so he will issue a certain separate task to decriminalize our criminal code. So it's one thing to create a venture fund, but it's another thing. Venture and investments are a higher risk. So with this in mind, two questions. The kind of question that really was of a concern in the course of the year, based on the results of the previous forum we discussed. as a professional, as an expert who has an enormous experience, how many years are necessary, do you believe, mm, for the long-term contracts? I mean, the budget legislation gives it 3 years, but clearly, what kind of a time frame we ought to be talking about today? And my second question that I also wanted to raise, in a very active mode, within the next few months, we will have a discussion of the so-called an agreement on protection of the incentivization of the capital investments. There aren't any special things about it, and as far as what the problems are being discussed today, does the Minister of Industry do any work? Are there any ideas that it has so far put down on paper? The preparation of the amendments for the second reading is already ready, but I do say that this is another good instrument, investment instruments, for those who might wish to have long-term responsibilities. Yes, sir, thank you very much. So, with respect to the long-term contracts, absolutely proper topic, we believe. And the Minister of Healthcare has undertaken a step towards it last year. I believe that Sergei Alexandrovich will correct me, but I think that last year, and Vladimir Christenko will also mention, I think a 2-year contract was signed for the Pentaxim, for the delivery of polio vaccines. Yeah, polio vaccine. Right. So, speaking about the time frame, well, quite clearly, on the one hand, we find ourselves in a formal procedure, and any long-term contract, if we want it to be confirmed by available cash, that can only take part within the 3-year cycle, the 3-year budget that is being approved by the cabinet. But this, in itself, I believe, is a very good interim step for the manufacturers of products in order to be confident that within the 3-year period they have a very clear understanding of the amount that they need to produce, what kind of price will be paid for it, what's the pricing basis for it, and respectively an understanding of what one should plan for the future in terms of the efficiency of implementation of such a contract, in terms of the reinvestments of the proceeds that the companies generate from employing such financial instruments with the government help, and then reinvest into the further development and manufacturing. So it seems to me that as a minimum, quite clearly a 2-year contract is also a good thing. But since we're having the opportunity to be confirmed financially to come up with the same kind of an example within the 3-year frame, that would be a correct thing. But further on top of it, one should take a separate look about the extent to which our capacities and plans can be upheld by the plans which we endorse as part of the strategic documents, where we may step out of the budget cycle. Now, from the point of view of the current draft law that the Ministry of Finance is preparing to incentivize bringing in additional investments, one may find in there certain differences from the document which Mr. Vakev was passed during the autumn session, which is the special investment contract. Why am I started mentioning special investment contracts? Because in the document, which is currently being considered to be prepared for the second reading and various amendments in it, about the draft law initiated by the Minister of Finance, one finds certain limitations of pertaining to some really solid amount of investments to be raised. So I would say that this particular document is for much serious, larger infrastructural projects. I would say I would describe it as more of a global story in terms of how to raise investments, including into infrastructure economic development in this country. While the SPICs, the SPICs, the level of investments that is written into it, and whenever we see a certain correlation with, amongst other things, with the preferential status that the SPIC holders do get, I think this is the instrument that has already proven itself, and it can be much quicker reviewed in terms of its applicability in the area of producing new pharmaceutical products in this country, not only in the vaccination and the immunology, but in any other area. Maybe I will look to say one other thing. In flu, we have really advanced very seriously, and Sergei Alexandrovich was talking about the tetravalent vaccine being registered in 2019. So the same thing. It is important to understand how this transition from the tetra from the trivalence vaccine to tetravalence vaccines will be undertaken. So it's really great to see that the companies nevertheless are going through a very active investments into it. And in 2019, Microgene, if you recall, towards the very end of 2019, I think it was in October, it was registered for the measles, rubella, and parotitis, our domestic vaccine, and amongst other things, there was a bit of an element of import substitution if you take a look at other import biological, immunological products, imported ones. So I do believe that this is the kind of a topic which is going to remain important, including other implementation of the legislation as far as the poly component vaccines are considered, because we will need to still discuss it in terms of efficiency, because we will need to cast an attentive look on the one hand on the efficiency, then the amount of funding required, pricing for these vaccines. Once again, we need to make sure that the quality, efficacy and safety is there, but also availability and affordability. This is one of the most important tasks that we're facing, so that the Russian citizens could enjoy the availability and affordability of these products. But at the same time, we've always used to say that one should identify a common sense balance between the public industrial policy and the public policy in the area of healthcare, so that we could also enjoy the possibility of providing the companies with the means of investing money into the new developments. So this is the kind of balance that we will try and maintain in the future as well. Thank you very much. So again, Anatolyevich, thank you very much. But it seems to me that it is quite appropriate now to try and engage businesses into this discussion. And I wanted to pass the microphone to Marwana Kar, the General Director of MSD Pharmaceuticals and the Managing Director of MSD in Russia, Belarus, and Kazakhstan. You are traditional participants of this discussion. Thank you very much.
Передавая вам слово, вопрос в следующем. Ну, во-первых, мои поздравления.
So first of all, I would like to congratulate you because I do know that last year you were able to find a partner. That was a very lengthy process, I am aware, and so in such an imagery way, we are talking about what kind of long-term contracts we should have. But what happens is that one should also take into account the fact that before the contract, you should spend some time looking for a partner, the kind put together with you in such a tandem to achieve a good quality result. All right, so my question is, so you found a partner. Now, what kind of opportunities you get through that? What are the plans? What are your expectations from such a partnership? And what are the main challenges that you identify?
Добрый день, and thank you for the invitation again. You're right, I've become a standard member here. This is actually my third Gaidar when we discuss NIP and vaccines. In 2018, we were talking about the value of vaccine NIP and its impact on population health and the economy. I think we've covered that. I think everybody now agrees that this is important, especially when you talk about life expectancy and Russia's goals. In 2019, we were talking about the challenges of successful NIP and what can go wrong and what questions we need to answer. So it's great that today we're talking about what makes an NIP successful. So it's certainly a positive evolution of the conversation. And hopefully in 2021, we will be looking back at some successful NIPs and see how we can replicate those as well. To answer your question, yes, we finally did sign a contract with a partner. Actually, as a company, we've been exploring localization of vaccines in Russia since 2008. So that's about 11 years. So it's quite an achievement that eventually we settled on a partnership. And it's not really us only selecting a partner, it's a partner also selecting us. So actually in this room, we are working with two partners. For human health, we're working with Fort, and in animal health, we're working with Nanolec. The good thing in Russia is there are good partners already. So when you're selecting a partner, you're looking at their capabilities, both in terms of equipment, space, GMP. These are very technical things. But to us, it's not only about their current capabilities, but also their future plans. What is the strategic direction of that partner and their investment plans to get there? And the last thing, which is actually extremely important, we look at culture. You enter these partnerships for 10 years, 12 years, sometimes even 15 to 20 years. Most of these contracts are a minimum of 10, but after 10 years, you don't want to go somewhere else, right? So you want to make sure that there is a fit in the culture between the two companies. And it's not going to be perfect from the beginning. It will never be perfect, but at least there should be some common ground where you can, work together. So far, so good. We're learning as we go. We actually just signed in July, and we hit the road running in October, and the project has started. It's both a commercial project, but it's also a manufacturing project. So that's in terms of how we got here after 12 years. Our expectation is that we will succeed together, and success means making sure we have good quality vaccines that eventually will be in Russia, made in Russia, that will be there to enable and supply NIP. And protect lives of Russian children from infectious diseases that are now preventable, that we now know can cause cancer and cardiovascular disease, and as a result, really help support the government in reaching its life expectancy goals that are set by the president.
С позволения я тогда дополню. Вот
Can you hear it, the translation? Right. So, if it works someplace else, then it means that we can do it here as well. So my question is, what is the depth of planning for you? Is a standard, a norm, on the one hand, as well as sufficient enough for a manufacturer to be able to take into account certain things in its manufacturing plan and then stay successful in performing one's obligation under the contract?
Can you rephrase, please, because I missed the first part of the...
Не могли бы повторить, перефразировать ваш вопрос?
What is the depth of the planning is believed to be sufficient by manufacturers based on your international experience? What is the depth of planning in your other markets, in other countries, where you, as a manufacturer, find comfortable to work with?
The more planning you do, the better,
Чем
of
больше
course.
планирования у вас
The
есть, тем
planning
лучше.
should be
Поэтому
very
планирование
in-depth
должно быть
and should include
глубинным,
all
должно
required
включать,
investments.
все
It should
возможные
include the roles and
инвестиции,
responsibilities, what should the
роли
partner
и
do versus
ответственность,
what the
что
multinational
должен
should be
делать
doing.
партнер, в чем
It
заключается
should
ваше
include timelines
сотрудничество. Здесь
and
обозначить
who pays
временные
for what
рамки,
and by
кто
when and
платит
what
за
should
что,
be achieved
когда
and
и
trigger
что
points.
быть
Having
достигнуто
said
к
that,
определенному моменту,
at the end of
обозначив
the
это,
day,
в
it's a
конечном
plan.
итоге это план.
That's why it's important
Поэтому
that
очень
there's good
важно,
intent between the two
что
partners,
существует доверие
that while you
между
go with the
партнерами
plan,
с тем, чтобы
things do
когда вы начинаете
happen,
реализовать
and
план,
in
случаются
many
разные
cases you
вещи,
have to
случаются
adjust as you
неприятности,
go.
и поэтому
Does that
необходимо
answer your question?
быть
Did I get
гибким
you
в
right?
рамках реализации. Я ответил на ваш вопрос?
Thank you. And Mr. Rachov? Yes, and quite clearly I would like to pass the microphone over to your partner. Let me introduce Pavel Vondyshev, the General Director, or Ford. Pavel Evgenievich, a few questions. On the one hand, I really should commend you. Mr. Marwan said that both sides are making a choice. This is not just one party looking for another one. This is a joint choice. So what are your impressions about how you achieved it, and what are your current expectations? What kind of opportunities you gain out of it? This is on the one hand. On the other hand, basically your own manufacturing issues, because it has already been mentioned today that you have successes with the flu vaccine, maybe anything else on top of what we previously heard, that the best thing is for the businesses to say what they're doing. And the third question, if I may, a certain success formula. What is it that you're working on in order to remain, a true player in such a market, because this market is quite narrow, it is very highly competitive, and there are very few players in it, as well as wine. Yes, thank you for giving me the opportunity to speak. Thank you for such an open discussion. I would like to say that when considering immunological aspects of biological health, this is a very high-tech kind of manufacturing and business. Generally speaking, if you take a look at the volume of the immunological and biological products, but used not only in Russia but globally, you can see that there's always a shortage of something, APIs, finished products, and so opening such manufacturing sites requires a lot of time, a special professional training system, and certainly absolutely new state-of-the-art technologies which change every year simply because technologies and the research evolves continuously. So the first thing that I would like to mention about the flu vaccine, yes, we've been quite successful in it. It's that the results of our work enable the Minister of Healthcare to enjoy the opportunity of expanding the models of application of the flu vaccines, and the amount of tetra component vaccine exceeding the 5 million is what we've been joint considering. But switching to the 3 to 4 component vaccines, one should understand, will take at least 4 years. This is statistically, but on the side of the technology, you will need to increase the output of the API 2.5 times, which is something that all the manufacturers are trying to work on, because that requires a lot of investments. So here, one should say thank you to the Minister of Industry in terms of the resources that are being made available, in terms of the time that is being allotted for the technology development. This is one thing. The second, the biggest driver in our case for those who produce the immunological and biological products, the interest on the part of the government in producing the kind of products we're capable of producing or localizing their production. And the second driver is timing, because that is the most important one, I would say, because the development of a product takes decades. And whatever we are able to use today in cooperation with the leading international partners, that is a reflection of the long-term experience that they have been able to generate and apply here. Secondly, the localization and registration of the product itself at least takes 3 years as a minimum. Excellent initiative from the point of view of long-term contracts, specifically the one that at least within the next period of 2 to 3 years makes it possible to plan for the expansion of manufacturing, plan launching new productions, and consistent localization. But one should know that based on the kind of task that the representatives of the Ministry of Health, Care Ministry and Ministry of Industry stated, there are quite a few vaccines which are not being produced in Russia based on the full cycle, which means another big journey in terms of having them localized. So here you should definitely consider the initiative of a long-term planning capability, bearing in mind the guarantees that our partners, yes, last year we entered into a contract with respect to a number of vaccines, and our colleagues also pursuing such initiatives, but with the possibility of entering into the specific calendars and lists, so as to be able to understand the time frame that is allotted to us to achieve it in the full cycle. In as far as our partnership with MSD is concerned, we're very proud of it. We do believe that this is one of the biggest successes for us as a young company, when Arman said that we were choosing, well, yes, certainly, we have been appreciated. And so this is very much of a mutually beneficial partnership, which entails a lot of opportunities both to our company in order to be able to really act on the kind of the tasks that the Ministry of Healthcare and Industry are setting, the human virus papilloma, as well as foot and mouth, as well as the smallpox. We are very proud of this contract. We are actively engaged in it, and in some foreseeable future, we will go about the transfer of these products, and this product is going to be made available. But our contractual capabilities enable us to work on different problems, all the way to the full localization stage. So either the Minister of Healthcare or here there will be support by other regulators. We will certainly be eager to try and go about localizing this product further for the purposes of the National Inoculation Calendar. We're a young company. Effectively, in 2013, we put the first foundation at our manufacturing site, and the success is not something supernatural. It is the result of a very consistent effort in between the public and private initiatives, which, on the one hand, enables us to invest into where the product is very much sought after. Secondly, also ensures a very high quality professional training, because this is not a problem in Russia, because there's no institution available which trains and educates industrial experts in the area of immunology and biology. And the third point, cooperation, because during the initial learning curve, we relied upon several elements of cooperation with different companies and Microgen, and today we are happy and really fortunate in gaining such additional expertise with MSD, and so our willingness to do more and cooperate more actively is what will guarantee our success. Again, immunology, biology is a very restricted kind of a manufacturing acumen. And so within the next few years, considering the requirements on the part of the Minister of Healthcare, I wouldn't say that we'll have to do everything from scratch, but we'll have to really increase what this little industry would be capable of turning out. Yes, thank you very much. Now, taking this opportunity, I know that Sergei Alexandrovich's schedule is such that he will have to leave us very soon, but I would like to pass the floor to Guillaume Ochalter from Sanofi Pasteur, General Manager for Russia and Belarus. And so here, there's a very interesting comparison, because you are exactly the company which for quite some time has found its partner in Russia, and you have covered a certain path here. And so by passing this medley over to you, first, please accept my congratulations that you already have a notable success. You already have a 2-year contract. That is an achievement in itself. But nevertheless, again, to carry on the topic of localization, what you have covered so far, looking back, have there been any reefs, any mistakes that you could have avoided, or principally you did everything correctly, and now, from the top of the half-covered journey, what are your further expectations? Because I do remember that you previously had this question in the discussion that only the process of passing over the packaging technology takes a few years. Could you please share with us what you think?
Thank you very much for your question and for the invitation. I'm very happy to be here with our colleague from MSD, because you know that our both two companies are accumulating more than 200 years of experience in vaccine manufacturing, and I think not so many companies in the world can have this track record. And I'd just like to come back on what Sergei Alexandrovich mentioned. I think something very important. You mentioned the quality of the vaccines, and I remember last year we had the same discussion. It's key to be taken into consideration. I think nobody here in the room will take any risk to have like a generic of a vaccine. You wouldn't take this risk as a government official. We wouldn't take this risk as a manufacturer, and I think as the parents here all around in this room, nobody would take the risk to have a cheap vaccine for his kids. And it's extremely important to mention, because I will answer the second part of your question first before the long-term contract. It takes time. It takes a lot of time to manufacture a vaccine. Taking the examples that you mentioned, our pentavalent vaccine needs 3 years to be manufactured. So meaning I'm starting today in January 2020 to manufacture the doses I'm going to sell in January 2023. So I need already to understand today how many doses of vaccine I will need in 2023. And this is crucial to understand, because these 3 years we spend, and I believe it's the same for our colleagues, we spend 70% of the manufacturing time in quality controls. So more than 2 years are dedicated to control the quality of the vaccines we are going to inject in the Russian kids, in my kids, in your kids, all around the world. One dose of Sanofi Pasteur vaccine, which is released for the market in Russia by our partner, has the same quality as a dose manufactured in the US, in Europe, anywhere in the world. And at the end, you have the stamp of Sanofi Pasteur. And we will never take any risk on the quality. There is no GMP-like for the vaccines, and something that was already mentioned in some forums. And it's crucial for us to understand that I don't remember any kids dying from one of our vaccine, one of the Sanofi Pasteur vaccine in the last 10 years. But I do remember that we have one child dying in the world every 8 minutes from a vaccine-preventable disease. So, taking all of this into consideration, answering the first part of your question on the long-term contract, yes, we were lucky to start working in advance with our partner, with the government, on anticipating the demand. the birth cohort is rather stable in Russia, and we know already how many doses you will need next year, and you will need in 2 years, in 3 years, and so on. And it's, for us, the ideal target would be a 3 years contract, which corresponds exactly to the manufacturing timeline of the vaccine. We have 2 years. We will work on it with our partners. And it's also a big advantage, and here I'm talking to you, it's the price. We have the lowest price in the world today in Russia for our pentavalent vaccine. We are 6 times cheaper than we are in China, and more than 15 times cheaper than the vaccine in the US. So it's also represent for you the guarantee to have the cheapest price, because the volume is more considerable on one side, and it's also, as you mentioned, the risk of out of stock. It's also covering and ensuring that you will be prioritized in case of any issue in the manufacturing of the vaccine. You are almost sure to have the doses available for you and for the Russian kids. So yes, this long-term contract, this 2-year standard for us is a very, very good step. For sure, we are working, and we need. I think we need to expand it to the manufacturing timeline, which is 3 years minimum. Definitely. I take an example in Algeria, we have a 5 years contract. In Mexico, we have a 15 years contract. In India, we have also 8 years contract. In South Africa, 12 years contract. So it depends on the country, but we have the predictability on the demand, and the consequence of that is a cheaper price for us. Answering your question on the partner, we started a little bit later to look for a partner, but maybe we were more efficient because we signed an agreement with Vladimir in 2015 in the St. Petersburg Economic Forum, and it's like a love story. It takes time to build, and you go step by step, шаг за шагом. And so we started by the packaging. It's already 5 years now. Now we are going to make the fill of the syringe of this vaccine. It took 5 years. It took 5 years because, once again, coming back to the first part of my speech, we cannot afford to have any risk on the quality. And we are very happy and very lucky to find this partner. We have a lot of quality partners in Russia. It was difficult for us to find one, to be honest, because we have a wide choice. Exactly as you mentioned, Rowan, you need to see long term. You don't make you will never find a plug and play partner. You will always have to invest and to share your knowledge. And you will never find a partner which fits 100% to what you are already doing from 100 years in Sanofi in France. So it takes time, and you need to see long term. You need to see above 15, 20 years. Otherwise, as you mentioned, there is no win possible on the long term. So we are here today in Russia with our partner Inoculation for hopefully the next 15, 20, 30 years. And this is also allowing us to have, I'm answering the third part of your question, to have a long-term vision in Russia for our business and for the benefits of the Russian kids. You talk about the combo vaccines. Our target is to launch new vaccines in Russia, to switch from pentavalent to hexavalent vaccines maybe one day. And here, let me maybe talk a little bit longer on the advantage of the combo vaccines, because you mentioned also, both of you, Sergey Antonovich and Sergey Ivanovich, you mentioned that you are introducing new disease in the calendar. It would never be possible without having already combo vaccines. By having combo vaccine, you reduce the number of injections in a child. You have a better adherence to the national vaccination schedule. And it's cheaper also for you because you limit the number of injections, you limit the number of visits to the doctor, and the parents have, and as a father of 4 kids, I know what I'm talking about. When you receive an injection in your child, which is crying, you try to minimize the number of injections in the legs or the shoulders of your baby. So by having these combo vaccines, you ensure that a wider coverage, and you can introduce new diseases such as you mentioned varicella. I hope also for meningococcal infections. One day could be in the calendar. So the advantage of these combo vaccines in all the fields is, again, a financial advantage for the government because it's cheaper. If you take the full picture into consideration, it's a better adherence, it's a better expansion of the vaccination schedule, and at the end, it's a healthy kids, which is aligned with the strategy presented by the President of life expectancy increase and reduction of usage of antibiotics. I hope I answered your question.
Надеюсь, я смог ответить на наш вопрос.
Yes, I can't comment on certain things. Thank you really very much for such a sincere view on some of the issues. I was myself talking about a balance in the area of the government, industrial policy and healthcare, so it is quite important on the one hand for to be able to make affordable products, on the other hand for the companies to be able to invest and to create these products locally, amongst other things. That would be positive in terms of pursuing your own business interests in the good sense of it, meaning to say that one has to retain the possibility to invest in new developments and be able to earn profit. So this is the kind of a threshold that we would definitely need to identify. Long-term contracts is one of the set of instruments which in this area could be an effective solution. Another point that I wanted to draw attention to, we didn't yet speak about it today, so my apologies, I didn't mention it, but it is very important. If you take some of the areas where we already have the immunobiological product, and including the presence of the international companies, very few companies globally are producing such products. I don't know, just take a look at the human papillomavirus. There are just 2 companies that produce something. Take a look at other products. There are really very few of them. So if we talk about localization and at the same time in localization we issue certain preferences like the instruments that we have discussed, and Mr. Farahov first spoke about it, be it the Minister of Finance draft law to incentivize investments or special investment contracts or any other tools, it is quite obvious that an establishment of such a manufacturing site in Russia, definitely this is the story not only for the Russian healthcare. So taking this opportunity, I would like the representatives of the international companies specifically to view this localization in such a light. Why? Because if, principally speaking, there is a limited number of players in the world, it is also important to take a look at the efficiency of the manufacturing of such projects, specifically in Russia. It may be much stronger, much higher compared to when you place your manufacturing capacity in other countries with a different level of development, and when, in the case of Russia, you get a long-term future as well as exemptions and preferences which will be conducive to creating a highly efficient manufacturing capacity in Russia. I believe that this is the kind of an angle that the international companies should be looking from at these opportunities, which should also correlate with various legal initiatives by introducing certain new vaccines into the national calendar, or amendments into legislation which provide for a much more flexible consumption and better terms and conditions for the manufacturers and suppliers in terms of the guarantees of demand. So we could correlate these together with the plans of exporting such products and developing this exporting capacity inside Russia. This is definitely the kind of opportunities that we have, and we need to make sure that all of these things correlate with each other in terms of the further improvement of the currently existing law. Thank you. Colleagues, unfortunately I must leave you, but I would like to say thanks a lot to everybody and just make one comment, which is about the following thing. What we're talking about is that indeed one should gradually move towards combined vaccine, which requires just one injection. But from the point of view of Minister of Healthcare, we should definitely have a mono vaccine. Why? Because not always. The methodology of vaccination itself for different components is the same one. Second thing, there's always a situation when you have counterindications against certain groups of infections. And therefore, I'm grateful to Guillaume for what he said. But once again, I would draw attention why it should either be domestic or localized production, because we must have the whole spectrum of vaccines, be it combined and polyvalent and monovaccines. This is extremely important for our citizens, for our children. At this note, once again, I would like to thank you very, very much again. Thank you. Now we'd like to pass the floor over to Vladimir. Vladimir, my congratulations. In 2019, you went through a whole number of positive developments, like signing the new contract with a partner. It was, but definitely, I'm sure everybody noted it, was your sort of entrance into the sustainability periods amongst the startups. But I would like to ask for the forgiveness of those who know quite well. This is again the statement from Mr. Pasteur, the very same Pasteur, who, following one of the laboratory experiments that he went through, said that the fortune favors the prepared mind. And so, what I meant to say that at one of the forums, we were having a conversation about why you dived head over heels into this kind of business. So, as opposed to the Russians saying that fools always have luck, I disagree totally with it. The luck is with those who differently deserve it and work on it. And so you, did this very impressive, covered an impressive journey. So it would be very difficult for you to, again, put and bet everything that you have upon zero. So again, my question about the depth of planning. Quite clearly, at a certain point in time, one is ready to risk everything and dive deep into the startup and venture. But nowadays, being a well-established businessman and a notable player, what kind of a depth this should be so that you could identify and think through your strategy long-term as a mature business? Thank you very much, Alexander. It's a great pity that Sergei Alexandrovich left us. I wanted to thank him for his kind words, and thank you very much for your kind words as well. But I suppose we've come here not to sing Hosanna to any of the participants, but to touch upon certain problems which probably many understand, but the kind of problems which are not clearly articulated sometimes in the course of such discussions. First of all, I would like to start with a phrase that we always mention whenever we talk about vaccines and prevention, like what Sergei Alexandrovich stated, that there isn't a more effective investment into healthcare compared to investing into vaccination. Again, based on the WHO data, cumulative effect is $16 per every dollar invested, based on the data from certain other healthcare systems. It's even greater than that, and that is important. This country's healthcare systems and our venture is developing quite actively, and our inoculation calendar is developing quite actively. It starts to include new infections like pneumococcus infections. Combined vaccines are being applied now. This is very good, and the budget is growing because over the past several years, from 8 billion, it grew up to 22 billion. So positive changes are obvious on the one hand. On the other hand, there are certain other aspects which, to my mind, currently are not allowing this industry to develop at the kind of a pace that it otherwise could have. And similarly, I would like to go straight over to the main statement, i.e. a great number of various support programs in terms of investment attraction and so on and so forth. Honestly speaking, they could have been substituted with just one thing: the guarantees of developing the inoculation calendar, as well as the guarantees for the procurement of vaccines within the expanding inoculation calendar. Speaking about the vaccines which are already in it, it's a bit simpler, but nevertheless, it is still a complex situation. If we go back to the case of polio vaccination, which currently can be deemed to be successful, but to be honest, let's be open about it. It's a bit of an accidental thing, but that illustrates the way the timing in this industry looks like. Now, the polio vaccine localization was started as a project back in 2012. In 2017, when we had a finished product, it took us 5 years. And so we ended up having a problem that we heard about. Global deficits of polio vaccination, which, amongst other countries, Russia was part of. Thanks to the availability of the finished product, thanks to the agreement which was signed 2 years before that with Sanofi, we were able to clearly and quite quickly deal with this problem. And what Sergei previously mentioned, last year we signed this agreement with the Chumakov's Institute, who has the full cycle polio vaccine development, so that in 2022 be able to launch the full cycle manufacturing in Russia, and by 2027 enter into the WHO market. So this is the whole picture for you, from the idea to full cycle, 10 years, not because we're so slow. This vaccine is already part of the inoculation calendar, 10 years. Before we start exporting, 15 years. This is not some kind of timing which I'm being, hypothetical about. I'm giving you a real case of a real project. We, as a commercial business, we are as motivated as we can to do it faster, not to delay anything, because every day we take loads, we pay interest, and every day, in our case, it's a direct loss. So we are as motivated as we can to do it quickly, but that requires time. So full cycle requires 10 years, and this is a real thing. At the same time, these 10 years must be spent wisely to accumulate competencies, to raise personnel, to establish capacities, investments. This is an enormous, humongous amount of work. But the most terrible thing, regrettably, that towards the end of this work, the situation evolves in such a way that there is no guarantee that the kind of a product you're going to produce will be in demand. And I suppose that this is the biggest thing that deters this industry from development. You don't need any support, no subsidies. You don't need anything apart from the guarantee that in a certain year, this kind of vaccine will be part of the calendar. Unfortunately, Secretary Alexander left us, and I wanted to ask him a question, because the foot and mouth disease and the smallpox is something that we're hearing not for the first day. Until recently, it was mentioned within the context of including this in the calendar by 2021. It's already not there. We're talking about the 2023. All right, 2023 is still good. Where is the guarantee that in 2023 you won't say that it's going to be by 2025 or by 2050? We, as the manufacturer and as the public partner, it's a monopsony quite often. This is just one manufacturer and one buyer. And you can't have it in such a way that this one manufacturer produces something that the other party doesn't need. This will never work this way. So again, as you correctly stated, this year we have advanced in terms of contracting arrangements with the GlaxoSmithKline. We have signed a contract to vaccinize the smallpox vaccine with Sanofi, which is Sanofi Pasteur vaccine against the multi-monococcus infection. But based on fact, there are no guarantees, no present representations as to when this vaccine is going to be included into the calendar. Again, if you take a look at the Russian Consumer Oversight figures, with your permission, yes, let me read it out. Official information, here is. From 3 vaccines controllable like meningococcus, then the foot and mouth. The economic loss was 53 billion rubles. The whole budget for calendar, 23 billion for all this infection. From these 3 infections, 53 billion loss. If we, for example, take a look at the cervical cancer, in between 28 to 35 years, 39 years, cervical cancer is the biggest cause of mortality. And so the question is, what are we waiting for? Not to include these vaccines into the calendar. So in order to complete my statement, we as the manufacturers, we have both the vision and the proposal. And I would like to draw attention to another thing, that in other developing economies, for example, in October, I attended the meetings of all of the vaccine manufacturers in Brazil. In Brazil, there are 2 big vaccine companies. In between these 2 vaccine manufacturers, roughly speaking, all of the national calendar positions have been shared. And these companies, and the company that is localizing, as long as this is a partnership project, its manufacturing capacity, they have a 10-year contract, which have everything written in it. 3 years packaging, 10 years full cycle. So it's all clear. Penalties, fines, pricing, how they change, and so on and so forth. So principally speaking, nothing Either, in order for this industry to really start developing it, you need. So quite clearly, in order to arrive at it, you need to do a lot of work. Epidemiologists have to say something. What's going to be sought after in this country? Whether it does apply to this country? How long would it apply? The government must say what is going to be the price that it will procure, or what kind of birth rate we're going to have in 5 years' time. So it all requires a lot of preparatory work in terms of being able to forecast it. But exactly like the work we do, it requires a lot of preparation, an enormous amount of time, resources to be invested, and intellectual capital to be put into it. Therefore, I would like to ask, it's not the first time that we're talking about it, everybody knows what it is, it's not the problem. I guess this is the kind of a task that we need to go for. Sergei Anatolovich, whose support we feel on a daily basis, every second, but unfortunately Sergei Anatolovich is not our customer. Sergei Anatolovich is helping us to implement our strategy, but it's the Ministry of Healthcare which is our customer. So apparently I would like to ask all those present here, those who are involved in this work, to go back to this topic. But once again, planning is good, but of course we are participating in all these plans. We are doing the work we do. Amongst other things, we're currently trying to produce a fully domestically manufactured vaccine against the human papillomavirus. And we shared all these plans with the Ministry of Industry. So we will do it by 2023. But again, at this point in time, to understand whether there is any particular volume that it might be required, we are not able to. I'm finished. Vladimir, thank you very much. Then basically let me jump a little bit ahead, because nevertheless our time has flown by quickly and we still have two presenters. Nikolai Ivanovich, yes, please get ready. I will pass the floor over to you. And Mikhail Albertovich. And exactly by way of the recipe, what we proposed upon the slide, that it is true, we don't at a certain point in time have this unanimous cycle of putting our efforts together. The only conclusion that I have arrived at is that definitely one needs to further improve the model of this discussion and meeting, and the format of the Interagency Commission, which I suppose should have a governmental status that would not only be under the auspices of the Minister of Healthcare, should be include the Minister of Healthcare, Minister of Finance, Minister of Industry, and the Antitrust Agency, because the number of issues raised definitely flows beyond the brim of the authority of the Minister of Healthcare. And again, the business should attend it. The business must be able to hear what is expected today, what are the milestones that it should go for. Now, again, a lot has been already mentioned here, but alongside with that, you, as one of the key participants of this working group in developing such a strategy, I would very much be appreciative to you to speak about a certain statement which we previously heard. We live in the new times. We do have certain kudos because in those Soviet of the past century, when vaccination started saving children, because the child mortality became totally different compared to what used to be 100 years ago. But alongside with that, more and more active is the inoculation throughout the whole life cycle of a human being. So could you please tell us briefly, what are the elements, what are the aspects in this concept that have been mentioned in the 2035 strategy? And the second statement, very simple. Today, any child, I mean, a culture of anything is being put together during the young years, and people, I mean, children know quite well what is an antivirus in a computer or a mobile or a smartphone. But what is a vaccine? Do children know about it? Yes, more know what's antivirus for a gadget rather than for a human being. So the questions about the awareness. Again, in what way these elements are being planned in this very strategy of 2035. So immunization, inoculation through the human life cycle, and well, you've raised so many issues, like we have one person, Russian, saying, that's not enough for us to dwell upon. So, dear colleagues, Vladimir Viktorovich in the first place, he was quite emotional, maybe, in the last part of his presentation, but I would like to still support him, because, yes, indeed, socio-economic importance of the infectious diseases and the vaccine-preventable diseases. We are talking about it at large and writing so much about it, and we are submitting our essays and considerations, but it comes to certain validation, and then we hear that the Minister of Finance somehow declined it. So, and it responded by saying, let the Minister of Healthcare do something about it, maybe reallocate its budget. So, 23 billion is a lot of money. Yes, yes. I mean, simple estimations do point that not only per $1 spent you get $16, and you hear 23 and even more. Undoubtedly, it's effective. But in our case, somehow it doesn't work out this way. And of course, this is for all of us to try and raise up to a higher level of awareness and so on and so forth. And so that is in as far as this particular point is concerned, but in as far as the strategy, I should say the development of the inoculation and vaccination, yes, we, the non-government public professional organizations, were the initiators, and I'm in charge of one of them, the National Association of the Experts, Infectious Control Experts, and in our magazine we have published, yes, a draft concept for the development of vaccination. It was quite joyous to see that later on the main provisions and points that we put in together with the Union of Pediatricians and others were reflected in the strategy text. And as far as the concept is concerned, life cross-immunization, which was proposed during the WHO's weeks dedicated to immunization, yes, it is marching all over the world and in this country, and one of the provisions of introducing this concept, which considers the inoculation as an instrument to protect every citizen from infectious, irrespective of the age, social status, the place of domicile, and the conditions of health care for a person throughout the full life cycle, like previously was mentioned, to ensure active and healthy longevity as the means to promote demographic policy, to increase the life expectancy. And here, of course, it is very important to define in the guarantee the entitlement and the rights of the citizens to gain access to vaccination, irrespective of the social level and the place of residence. And for this concept to be introduced here, I fully subscribe to it, and we've discussed it previously, that one should further improve the legislation which defines the inoculation, how it is being done, because the law on immunological prevention, it outdated. It requires reconsideration, changing, rewriting in many points in it, not only in as far as the responsibility for social accountability, for refusing vaccination, criminal nature of appeals against vaccination, like in the rest of the civilized world. This should not be allowed for. There should be a certain liability attached to it, and to change the structure of financing immunization, because today it doesn't allow for alternative sources of funding, and on the one hand it increases the burden upon the public budget, and on the other hand makes availability of vaccination to the citizens more difficult. What's very important is availability should not matter where you live, how you live. Yes, a number of new vaccinations may be limited because of the changing epidemiological environment and an emergence of new vaccines. So the position of the government here must be very clear and defined by additional immunization programs, like what we were saying, life cycle immunization. This is a new concept. This is not only children, these are teenagers, adolescents, adults, the seniors, people with various occupational conditions, as a result of various professional burdens. This is corporate healthcare. Corporate calendars should also be put in place. And so the new alternative mechanisms for funding as well, and of course the regional budget insurance funding, private pocket funding, commercial vaccination. Not a single country is where a government fully makes itself responsible to resolve funding for the vaccination. Yes, in a legislative way, somewhere. Yes, of course. Yes, the compulsory mandatory medical insurance funds. So we've got a lot of resources which haven't yet been tapped into, as well as of a funding nature, amongst others. Therefore, this is as far as, yes, vaccination should be considered at any age as a standard norm, as a standard of health care. That's what we should have, not only in the primary line, but also in the high-tech kind of a healthcare, so as to prevent somatic chronic diseases, this epidemiological transition that back in the 1970s we heard that allegedly that what is prevailing in terms of the causes of mortality, chronic somatic disease. Yes, all right, yes, all right. I fully agree with what Sergei Alexandrovich says, but there are so many other reasons, you know, behind the diseases. And so here it is very important for the vaccination as one of the, so to say, resources which may help us to solve the problem. But with respect to the adherence to vaccination, yes, this is the point that definitely I see there. Without doubt, it's in the draft strategy, and so I would very much like to believe that the government would ultimately endorse it. And here it is quite a difficult situation. It is important to understand the reasons behind this lack of trust that has emerged towards vaccinations over the past few years. Well, when global surveys were undertaken, it's a paradox, but in the mature economies, that's where you find stronger mistrust. France is in the lead, and Russia, you know, some 24% of the population, you know, negates safety, while the 13% negates the efficiency based on the global monitoring results. And the reasons here is not on the level of awareness. You need to launch a special study, special survey. And we are worried by it, and we're currently holding this service. As it turns out, about 20% of the healthcare professionals are being either negative towards or, you know, have doubts about vaccination. So, it's a very curious topic. I simply don't have time to tell you all about it. And yesterday, by the way, and here, we need to, you know, work jointly. We are a professional entity. We are busy with it. It was just yesterday when I held our first of the series of webinars. I'm Inoculated .ru website. Yes. So all of the correspondents may log on to it. yaprivit.ru or a different website. Come and I'll tell what it is. So it is very important to have a sociological understanding of what's behind it. Of course, an expert opinion is one thing, but the household opinion is also very important to know what it is, because they can be very different. Recently, we've been working together with the Public Opinion Poll Foundation, and towards the end of November last year, we held a big forum. Actually, you and I attended it together, I remember. It was the curious data that we, the medics, should take into account, together with the sociological people. Because, again, I shall repeat, it's not only about awareness. People do not trust healthcare. They do not trust doctors. People don't trust technical progress. Yes, of course. So it should be a multifaceted work performed. Yes, thank you very much. Now, Irina Mikhaeva, very short comment, and Mikhail Murashko will round up this meeting. Yes, I wanted to add a few words on top of a very proper statement made by the key speakers. But I would like to draw your attention to the fact that inoculation and prevention is not only about vaccines to perform a good, efficient and efficacious immunization program. There must be an infrastructure in place which involves logistics, delivery of vaccines, as well as an establishment of the necessary conditions for the administration of vaccines, as well as the technology to administer. This is injectables and devices with engineering and safety, alternative means of applying vaccines, as well as the technology for the recycling of bio-waste. Because if we talk about the expanding immunization program, right here and now, we should also understand that the waste is also growing. Costs to organize immunization will grow, costs to install equipment in the healthcare institutions, to pay wages for the personnel. We should also talk about the contemporary and modern oversight technologies of the immunization should also be put in place, which may require certain know-how transfer. Another thing, guarantees of long-term relationships in between the vaccine manufacturers. We, on our side, as epidemiologists, would be eager to share our epidemiological guidelines for the foreseeable future, which not only would cover the calendar period, but would also define the basic volumes that would be required based on the epidemiological guidelines. And whereas epidemiology is the accountability of the federal budgets, the infrastructure should be the responsibility of the municipal budgeters, regional budgets, healthcare institutions, and in many ways, because of about the quality of this, the awareness amongst the population, its awareness, its perception of the safety will be dependent. Mikhail Bertovich, you've got a key role to play. As I promised, I was trying to draw a system, and there was this kind of an umbrella, which is a controlling function. And in your intervention, I would dearly ask you to try and give us a certain summary, and in a bullet point to tell us what is the way that the Russian Healthcare Oversight Agency sees as the main tasks over the processes and stages that the whole system of immunization comes from. What do you believe to be the key aspect? What is it that we should work on today so that by 2035 our systems should be amongst the leading ones in the world? Thank you very much. Just about 5 statements very briefly, because I think time-wise we are very short. Yes, planning is extremely crucially important thing. We heard about it a lot. Every forum of the regulators of the pharmaceutical products starts with the prevention of deficit in the global markets. Basically, all the countries confronted. Therefore, scheduled, well-planned production and localization, full cycle is one of the key things, and definitely pricing and the government coverage of it. That is something that undoubtedly every nation is quite concerned with and works within a certain framework of plans. So whatever we previously heard, this is an important part, definitely. Now, the second bullet point is that today the Russian Healthcare Oversight Agency, in terms of its authority, something that we're concerned in terms of the execution of the national inoculation calendar implementation and epidemiological situations, is control over the volume of vaccination, the efficient application of vaccines, and I would also add to it a bit of a statement which may not be out of the jargon of the oversight agencies, is fighting against backwardness, because the medical personnel which is being negative in certain population, this backwardness is something that you do find, and this is something that is an obstacle on the way of implementing the plans that the government program of the is trying to pursue. The third point is in as far as the pharmacovigilance systems is concerned, because previously, together with the industry representatives, a number of activities were organized as applicable to pharmacovigilance and control over the adverse events as the consequence of certain drugs, because the current pharmacovigilance system can be easily stated is one of the most progressive the world over. I mean, the one that you find in the Russian Federation in terms of its comparison. We need to further improve analytical part of it, but overall it really currently functions quite seamlessly. Now, the fourth point is what was done on April 12th, 2019, methodological guidelines for the identification, investigation, and prevention of the side effects after the immunization, which have been developed by the Healthcare Oversight Minister of Healthcare and the leading medical agencies, which are our national medical centers. This is the key document which applies to an interagency cooperation. We have a few major exercises, and you may watch the video on our website. On October 10th, we had a conference call with all of the executive bodies. All of the key healthcare institutions were involved in it, and simply because the safety of vaccination control has certain peculiarities in it as a process, in the first place, this is a full connectivity from manufacturing to storage to vaccination outcomes and immunogenicity of vaccines and everything. This whole set is of a principal significance. There aren't any single bit which is of a smaller significance. So as a next stage, we should switch over to take into account small adversities, and there's an additional piece which should be really brought up, not only assessment of efficacy and safety of vaccines, but the efficacy in terms of not just at the global levels, whether the incidence of any disease is greater or lower, but the ability to investigate cases when immune system didn't switch on, was not activated, like in the flu and in some other diseases. And the fifth point is quality assurance, which is basically boiling down to the following thing. As of November 29th, and I am mentioning the date specifically because last year was very important in terms of many processes. This 2020 is not going to be less important, because as of November 29th, we have switched to new formats of releasing into the civil circulations biological products and vaccines, amongst other things. So all of the manufacturing protocols currently are being basically reflected in the healthcare oversight resource base, directly linked to every batch, to every series, and for every category there is an accountability on the part of the manufacturer to pass through the testing with respect to most important characteristics only in the government laboratory. So release into the civil circulations can be done only after the government-sponsored laboratory issues its quality assurance protocol. And I would like to mention that the healthcare oversight, as well as the Ministry of Healthcare, used to have 13 laboratories. As of the last year, in December, on the 30th, we have commissioned into operation another facility together with the Ministry of Industry. We were working on it, which is our Yaroslavl-based laboratory, which in the course of 10 months yet will have to create all of the internal processes and procedures and will be fully operational this year. So this process of vaccines quality assurance, additionally, there's a full spectrum of, there's a randomized control, on top of it, a control over complications and investigations over the vaccine that was in an organization, all the way down to the retention samples. This is everything that we do have. Something that we lack these days, there is an authorized person, there is a criminal liability, Article 238.1, which calls for a criminal liability for an individual's. Now, what do we lack these days? Like Mr. Hayev used to mention, that amongst other things, there has to be an administrative liability, financial liability on the part of the manufacturer. Currently, the Code of Administrative Violations is being further worked on, so as far as manufacturers are concerned who produce the kind of products which do not comply with the expectation should be applied to manufacturers as legal entities in the form of sanctions and penalties. This is very important. Many countries do have such systems in place. There's nothing supernatural about it. This is a normal business process. And so this is the responsibility of manufacturing in terms of the quality of the projects that they release. So these are the 5 points that I wanted to mention. And the very last one, the Russian Federation have passed through pre-qualification with WHO, specifically in as far as the quality of vaccination and vaccines, so the control over the quality of the vaccines. And today we do have this pre-qualification by the World Healthcare Organization. And therefore the Minister of Healthcare, the Minister of Industry and the Healthcare Oversight Agency have confirmed their competency, regulatory competency in this issue, and respectively whatever I've just mentioned to you are the contemporary and modern innovative practices that you may find elsewhere in the world. Thank you. Thank you very much, dear colleagues. Well, we're practically dead on time. Mr. Barkiev, may just one comment, with your permission. Many experts, my colleagues and the people who are in their areas are quite knowledgeable, so I've listened to them, and I got an impression that somehow we have created an effective system for the support of manufacturers and developers from the point of view of investment, environment, and different kinds of benefits and exemptions and instruments. The maximum possible set of opportunities in order to help them do the work effectively. We have created one of the most stable and most effective systems of oversight and control, something that we've just heard from Mikhail Albertovich about. And amongst other things, we do get confirmation of it from international entities. We have improved legislation that we were consistently working on during the past 5-7 years. In as far as the system of circulation of pharmaceutical products is concerned, creating a very powerful regulatory framework. And so here, it seems to me that from the point of view of what we are trying to do, it is very important to try and foster some kind of an ability to understand what is to be expected, what can be planned for, like Mr. Kostenko mentioned, so that there is understanding that in the Russian Federation, that the kind of products that are currently being worked on and planned will be in full demand by the system of healthcare. And Vladimir, with your permission, I would like to offer you a comment in return. You mentioned the human papillomavirus, that the preclinical preparation, clinical stage is about to finish. And so we used to say that as far as many vaccines are concerned, there are very few manufacturers, maybe 1 or 2 or 3, no more. And so it seems to me here quite clearly that the growth driver for the companies can be its own market, but in no way, once again, one shouldn't forget that in as far as the pharmaceutical drugs are concerned, there's never an individual local market. So that is why, amongst other things, we should think about how to promote competition so that other vaccine manufacturers may come into it, and we are ready to really consider it because we have a big national project to support non-resource export, wherein we're going to actively support pharmaceutical manufacturers who would be eager to export their products. Well, I would like to offer a comment back, despite the fact that we're currently going through the preclinical stage. The WHO, you won't believe it, WHO is who we are participating in a tender for the supplies of this vaccine sometime in 2027. But WHO will never buy any sort of vaccine which is not being manufactured for the regional market. Period. Full stop. Thank you. And just a few points extending on Sergei Anatolovich on your thought. I absolutely agree. The number one outcome is that we need to have a planning in place. There is a unanimity amongst academicians. There is an epidemiological guidance for many years to come. As long as it is there, we need to somehow approve it and move into the future accordingly. And then the Minister of Finance and the industry will clearly understand what is to be done in the future. So that is absolutely right. But I will disagree that the whole legislation is so perfect and that recently, just look at it, immunization. The debate of it in this kind of a group, quite recently, we have been at it time-wise, but there are a lot of things that we can say. And there are a lot of things which are changing for the better. At least people are starting to comprehend this system. I can tell you one thing. just legal regulation, introducing amendments into the law, or developing legislation would create to establish a normal market for the people so that people could find answers to their questions for the experts and for the manufacturers. Only legal work, no kind of decrees, no kind of agreements. So one ought to really set oneself to do work in the legal field. The results of the parliamentary work last year, 1,080 draft acts were submitted, 500 of them have been passed, only 11 laws which in them were the ones regulating healthcare. So effectively, if we want to develop a normal market for us to work normally, so that the market should not be based upon notional regulation, but upon legal regulation, Vladimir was very right in saying, if there is such an experience in Brazil, we need to do it then. We simply need to reflect it in the law that these are national tasks, national sovereignty and security. This is an enormous amount of investment pool. That's what I think. Secondly, without doubt, I would like to offer my gratitude. I'm simply just impressed by Marwan, by Guillaume, by the project that you are working on in Russia. Not only you demonstrate serious investment acumen by creating employment, but overall, this is a serious investment into the academic part of what we are. And I'm absolutely confident that you will be able to compensate the slow tariffs and prices sometimes in the future. And I would assure you that these investments will bring back not only material effect. A very powerful project, protection and facilitation of capital investment, which is being prepared by the Ministry of Finance. Big parliamentary hearing is coming soon, and I'm absolutely confident that we should raise the issues which apply to your areas of expertise, because they can simply be left out. But I can tell you that I have prepared and submitted 57 amendments into the special investment contracts, amongst other things. Free economic zones, public-private partnership, concessions you ask to take out of the regulation from this law. I don't know how the government may respond to it, but the amendment was submitted within the due time, and we asked for the special investment contracts to be taken out of it. You may talk about an entry ticket. Mr. Sulan, the Minister of Finance, also spoke about this is a good project. You can have it. And again, that applies to the legal regulation. Only legal regulation will allow to push it forward, because that fits the national task. And overall, Sergei Alexandrovich is not with us, but I wanted to mention that based on the results of last year's debate, we have prepared and we have submitted the draft act. For example, he was saying that we believe we're principally of an opinion that vaccination should be included only after the vaccine is produced here in Russia. But how can you explain it to people? That's what Minister of Healthcare thinks. I may understand it, but how can you explain to a person who doesn't want to get inoculated? We must be in a position to explain it, but nobody explains anything these days. And actually, we have submitted into the Russian parliament the draft law to the effect that the government in the second quarter, once yet another year goes down to report about the inoculation vaccination campaign. What were the problems? What are the plans for the future? The government didn't support it. You see, we've got to somehow change things around, because the number of citizens who are refusing vaccination is growing catastrophically. What are these people? Are they educated people? And they are educated people. And effectively, if we are to ignore this, nothing good will come out of it. And if you government don't support this kind of law, please introduce another law. This is the law about immunization and prevention. So if we don't write this into laws, if we don't explain it to literate, educated people, we won't be able to get anything good out of it. So this really is a big problem that we all together should work on. Thank you. Dear colleagues, just half a minute. Thank you very much to all the participants. I believe that we put an impressive debate, as promised. I take it as my accountability, all of the ideas mentioned, to be structured into a document and forwarded to the Minister of Healthcare, to the government, as ideas, as proposals, which should be considered and written into the roadmaps for the further implementation of 2035 strategy. So I'm very happy that we were able to be unanimous. We spoke in different languages with different level of emotion, but we all go down to one thing. Thank you very much. My congratulations to all of you.